Welcome to Medical Solve, and today we are going to talk about diabetes. We have different series under diabetes. We have type 1 diabetes, type 2 diabetes, pre-diabetes, the prevention, exercise and diet, other medication, self-medical tips. And today we are going to look at type 1 diabetes, type 2 diabetes and pre-diabetes. And please don't forget to subscribe and share. I'm your ever exciting host, Emigbo Miracle. Diabetes is a condition that implies the body's ability to process blood glucose, otherwise known as blood sugar. There are several types of diabetes which has various treatments. In the United States, the estimated number of people of all age living with diagnosed and undiagnosed diabetes is 34.2 million people. Without ongoing, careful management, diabetes can lead to a build up of sugars in the body or in the blood, which can increase the risk of dangerous complications. Different kind of diabetes can occur, and how people manage the conditions depend on the type. The most common type of diabetes are type 1 diabetes and type 2 diabetes. Type 1 diabetes, it occurs when the body doesn't produce insulin. Insulin is an hormone responsible for the breaking down of sugar in the blood for the use throughout the body. A person living with type 1 diabetes may receive a diagnosis during childhood. People living with type 1 diabetes need to administer insulin on a regular. Individuals may do this with injection or an insulin pumps. There is no cure for type 1 diabetes. Once a person receives their diagnosis, they will need to regularly monitor their blood sugar level. There is no cure for this type 1 diabetes. You need to regularly check your blood level, and most times if anybody that is diagnosed with this kind of diabetes, if he or she goes to the hospital, a doctor will prescribe drugs for them and he will tell them the kind of diet they need to take. Maybe they want to take bread, you tell them don't take sugar bread, take wheat bread, or don't take semo, take wheat, and don't take sugar. Instead of taking sugar, you take honey. Successfully managing blood sugar level can help people living with type 1 diabetes avoid serious complications. Complications like nerve damage, issues with the eyes, increased risk of skin infections, issues with the kidney, foot problem, high blood pressure, and stroke. Then we have type 2 diabetes. People with type 2 diabetes do not use insulin effectively. There is no need using insulin when having this type 2 diabetes. There is most common type of diabetes. This is the most common type of diabetes, and it has strong link with obesity. A person living with type 2 diabetes may or may not need insulin. In many cases, medication along the changes in exercise and diet can help manage this condition. Anyone, including children or adults, are likely to develop type 2 diabetes. The most common risks or factors for type 2 diabetes are age 45 or older, overweight, family history. Family history. Maybe your father or maybe your grandfather have this diabetes of a thing. It's likely that maybe your children or maybe your uncle might still have this diabetes of a thing. Pre-diabetes. Pre-diabetes occur when a person's blood sugar level are elevated but not enough for the diagnosis of diabetes. For a doctor to diagnose pre-diabetes, an individual must meet the following: glucose tolerance level of 140 to 199 milligram, an A1C test results, fasting blood sugar level between 11 to 120 milligram. People living with pre-diabetes has a highly risk of developing type 2 diabetes, but they do not usually experience the symptoms of full diabetes. The risk factors for person developing pre-diabetes and type 2 diabetes are similar. It includes being overweight, a family history of diabetes, a history of high blood pressure when maybe your family has an history of high blood pressure, being of African American or native of African, being more than 45 years of age. Type 2 diabetes are likely to affect both women, children, and men. In our next episode, we will be talking about prevention of diabetes. And please don't forget to subscribe and share. And I am your favorite presenter, Emigbo Miracle.